But this is very much about how we collectively work together right across the system. So all of us in this room have some professional accountability for ensuring that we know in our areas that our children feel safe and that they are safe. We wanted to share and learn together across the region. Safeguarding is the #1 priority for all the directors of children's services. Representatives here from the police, from the health community, from local authorities, from all of the agencies who have an accountability and a responsibility for children's well-being. So safeguarding now covers a wide range of concerns. It's very much gone up the agenda though, obviously, since the events of Haringey last year, when everybody has, I think, had a real, almost like a wake-up call across all of the organisations who have a responsibility.
I'm going to suggest to you that you are managing a field of inherent unpredictability, unknowability, and that trying to search for everything to be firm will lead you somewhat astray.
I think the conference today is about bringing senior leaders, political and council and partnership leaders together to help them consider what their role and responsibility is in providing firm, clear, supportive leadership to all of the staff in all of the agencies who have to do this most complex task of protecting children.
Creating a set of rules to prescribe good practice or protocolizing practice becomes an effective way of neutralizing blame. It also has a serious defect on stifling learning opportunities.
Taking what we've called a systems approach and trying to adapt it from the engineering fields and health fields for use in case reviews, including serious case reviews, but we're hoping people will use it in good practice examples and puzzling cases and areas of innovation of new working. What we've found with using the systems approach is that it really provides a better way of not only understanding what's happened when things have gone wrong in relation to a case, but really getting to understand the different factors that influence professional behaviour. So really getting to understand why things go wrong, because then recommendations can address those underlying issues. So in some ways the systems approach speaks to a lot of concerns that participants seem to have about the general morale of the workforce, and particularly of social workers. So it provides a way, a real collaborative process to allow for frontline workers and first level managers to really be involved in the learning process itself.
There is a big difference between the leadership required in safeguarding boards to bring all the potential partners together to solve the wicked problems of society, poverty, obesity, teenage pregnancy. And that can't be put down, in my view, to the responsibility of individuals. It's the leadership that needs to bring faith communities, local residents, business, as well as the services together that's important.
We can't commission a safeguarding service. If you look at working together, there are 19 plus the local authority agencies who have a statutory responsibility for safeguarding. What we need to do is make sure that safeguarding is present in the way that we commission all of that range of provision. About that relationship between children's services and adult services, and in particular what people refer to as the big five issues about learning disability, about criminality, about addictions and substance misuse, those kind of characteristics within families. Of course, they're also the responsibility of adult services. So how do adult services and children's services work well together? And the answer is often that they don't.
This is why that point that Anne made about the join up with adult safeguarding boards is so fundamental. Children's services will find out when that's wrong, but they won't know ahead when it's wrong. So the quality of our engagement with our community drugs teams, our psychiatric nurses is fundamental. Otherwise, we're simply going to wait for something to go wrong.
I'm talking about how leaders can think about engaging schools in the safeguarding agenda, and why safeguarding is important in education, and how that links to the attainment of pupils. We're also talking about linking attainment and safeguarding to school attendance. In fact, Ofsted, in their new inspection framework for schools, have recognised that safeguarding is a critical issue.
A real key message is it's not clear to children's trusts what's going on. We thought we quite understood it, we knew what the LSCB did, we knew what the children's trusts did, and by and large, it was moving along and we had arrangements and it worked. And now we have Lord Laming comes along, tears it all up and says something's going to change, but don't worry, I'll tell you about that in a while. So my plea from the children's trusts is please, let's work together, let's resolve some clarity in the South West.
Overnight you can find yourself as lead member. You have no experience, and yet the public expect you overnight to know every detail of your portfolio. How do you develop the ability to know when something is not right or something is being hidden to cover inadequacies in the system?
The question I'd really throw out to chief executives is, do you really know what it's like to be a director of children's services? And my second question to missing chief execs and others would be, do you really know what it's like to be a head of childcare services? And again, do you spend as much time trying to understand their world as we do trying to understand the world of our planners or the people who are delivering our waste and recycling services? And my third question, which is something to reflect and take away, how do we really know we add any value as a chief executive to these outcomes for children around safeguarding?
That provision, I would say it's very rare that our internal management reviews or our serious case reviews tell us that we didn't have the right policy or procedure in place, that our staff hadn't been trained to level 1, or that our allegations or safe recruitment procedures weren't operating policy. They are nearly always about decisions and risk assessments that take place in practice. We can't rely entirely on the inspection arrangements or registration arrangements of the regulatory authorities. We will need to have our own more sensitive local assurance mechanisms. Who's assessing risk? When the mum takes her child to MRU one day and the GP drop-in centre the following week and A&E the week after that, whose job was it to put that puzzle together and assess the collective risk? Do we know?
I think really one of the most difficult challenges we face is getting across to the public the fact that we cannot totally eliminate risk. And trying to communicate that to the public. We're focused on complaints, public inquiries, negligence claims, which can lead to risk being avoided and inappropriate decisions being made because of a fear of criticism. And the key area that comes through there is communication. Every time, communication. How many times do we have to keep saying it? And we have a culture, or we've had a culture within the police service, need to know. And when we're sharing intelligence in this area of business, surely we have to have a culture of dare to share.
I secondly want to just pick up the issue of risk assessment models. Those of us like me who've been around for a long time have worked with 2 or 3 types of national assessment models. I think we now have a triangle. I hope I'm not being too diagnostic here. The assessment triangle. I think you can address risk through it. But I have some sympathy with a view that says it doesn't address risk very well. But we need to be very careful that in this climate we do not move towards rigid defensive models which are actuarial and don't actually tell us what's happening. And I guess that's a clue for me to say we should be alert to the danger of authoritarian practice creeping in. And I guess what I'm saying is this system has been battered. I use that word very deliberately. And this audience knows too well how the bullied can sometimes become the bullies. Vulnerability window where the policy people have a stream of thought which is more expansive than our practice people. I mean, that's a generalisation, but I do worry about it.
Having the requisite level of knowledge. Secondly, being in receipt of good managerial mentoring, supervisory and some emotional support. This is a very difficult and complex job they're being asked to do. I think thirdly, having confidence that they, as a frontline worker, are working within a set of relationships with other agencies on whom they depend to develop an understanding of a child's needs, that they're confident that there are processes in place by which I, as an individual practitioner, can talk to the head teacher over there with the expectation that she understands that we have a shared responsibility to pool our information in a way that understands that child's need. Probably the hard question here is, how do I imagine that vision can be achieved in the current set of media climate, political fever about safeguarding, and the upcoming crisis in public sector finances?
We do tend to presume both that we know what should have happened and we know what good practice looks like and how it should be put into play. All we need to do is control the pesky people who mess it up. You know? It's Eileen's complete point about going back to rule-based. So what we tend to do is just to limit the scope for human judgment, proceduralise things more and more, and damn people if they don't keep to the procedures.
Rather than always focusing on the negative, what we want to do is to focus on the positive and actually develop our understanding as to what good practice looks like in safeguarding.
I guess if I was really pushed about the one thing above all that I hope as this conference we can achieve, it's that recognition amongst these senior leaders that the numbers are not the whole story, that the numbers need the narrative. In other words, it is the narrative that gives the meaning to the numbers.
How do we develop performance targets that are meaningful and really focus on outcomes, not sort of outputs dressed up as outcomes? So what that means is we need to focus much more sharply on what really are the results we want to deliver, how do we measure those, and how do we make sure that our indicators face towards that.
Getting people together, I think, and communicating, because actually everybody is working to the same end.
Because we know that only by working together are we actually going to ensure and assure children's well-being.
We really need to, I think everyone's in agreement, we really need to up our game when it comes to learning from frontline practice, and I'm really looking forward to working with people in the South West as we take the systems approach forward.
I think children's services need to be much more proactive in going out into adult services to deliver that agenda around substance misuse, around those areas that we know are concerned. If we do that, I think potentially we can deliver better outcomes.
I do believe it's about distributive leadership, and that we can have leadership at various levels and ownership at various levels of the safeguarding agenda, and that I do believe that everyone that works with children have their interests at heart in terms of achievement and attainment, and it's about offering life opportunities, and people who work in education and all those people who work in children's services have that same goal.
We need to have a big picture and an ambitious picture for children to keep them safe, but at the same time we need to ensure that our services for the most vulnerable are working properly. The agenda is so huge that my advice is be more ambitious about less. Choose one or two things and do them well, and then that will start to improve the rest of the things that are done.
And they say this, that leadership is the nexus that enables people to take risks, to go beyond familiar practices. Whilst intellect will be important, emotional intelligence, they say, the ability to take into account how different professionals see their roles and bring them together, will be at least as important. And a very simple description of collaboration is how we work with people so that we move from my business and your business to our business.
But we are in anxious times. We do have to meet the challenges that the media present for us, the way in which the dialogue happens with the public. We do have to ensure that we're actually building on positives and not always concentrating on the negatives and the risk aversion. That is so important, but that's also quite tough, and we have to be brave. One of the contributors this morning has already mentioned the importance of communication. we know from serious case reviews that we come back to time and time again, failures around information sharing. The message from today is dare to share.